Today, I'm going to talk about what it's like to have a career in healthcare. And I like that Dr. Wu said that you must be really motivated to be here today because of the weather. But how many of you are from New Hampshire? Okay, a good amount of you. How many of you have never driven in snow yet? Okay, good. So you know what it's like to drive in this weather. Taking a look at just a workforce summary, I thought it'd be helpful to give you an idea of what it's been like over the past 5 years in healthcare and how that's really changed the face of how we both retain and recruit employees, but also has really put us at the forefront for being a career of choice. And when you think about getting an MBA or what you're doing in business, really in healthcare, there's a job for any sector. So don't just think about nurses and doctors and clinical staff. You really need to think about the wide array of people that need to come together to make a hospital run or to make a clinic run. But when we look at over the past 5 years, I feel like we've kind of transitioned from, and I think some of this language is actually becoming old, but this notion that we had people leaving the field because of the threat of COVID-19. We also have people leaving the field because it's actually a very tenured workforce in terms of people going into it in many different generations. Right now, we have 5 generations working in the workforce. And so we do have a number of people that have become retirement eligible and they're leaving, but yet the patient demand continues to rise. So thinking about in New Hampshire, we have 1.3 million people in New Hampshire. And in this rural geographic location, Dartmouth Health is actually the only academic health system in our region and in our state. So we have a real desire and need to continue to provide care for the state's most vulnerable. We're also, New Hampshire and Vermont, I think, are the first and second, if not the third and fourth, oldest states in the country. So that means that we have an aging population who then is going to need more health care, right? So the cycle continues, and I think that opens a lot of doors for people, regardless of the degrees that they receive, but especially for MBA, people with business backgrounds, because you really can enter the workforce and work in a variety of positions. Right now, we're working with many different schools to try to understand how schools are promoting healthcare as a field. So I know Plymouth State has a healthcare component that you can take from the MBA program, but also how do we really get in and produce some of the technical positions that some of the schools are not producing anymore. So if you look at the work that we're doing within our organization, our strategic priority is really to optimize our workforce, decrease our dependence on contingent labor, or otherwise known as people traveling, and they may be going hospital to hospital, and then really being the employer of choice and leading in that way with creative programming. And you'll see here some of the gaps that we see in the workforce. So when we look at this, you'll see many of the positions that we need moving forward, we're going to have a workforce shortage in. So the fastest growing healthcare positions between now and 2026, which actually is only a couple years away, right? We're there now, are the physician assistants, physical therapists, nurses, physicians. But what you see on the graph over to the right is what that's demonstrating is really showing that while the demand for clinical work grows, the workforce is actually shrinking. And that's because we have people who are leaving the organizations, like I had mentioned, through retirement, and we just don't have the people coming into the workforce. So in terms of the work that we've been working on, is we know that by 2026, we're going to have a pretty big gap. And you'll see here that it's an estimated 10.8 new healthcare workers are needed by, as we turn the corner of 2030 and beyond. So when we think about how do we close that gap, one of the things is we need business professionals to come in and say, how do we actually provide care, maybe even in a different way than we have before? Maybe we're not having a nurse do XYZ position. We'll have another position do that because we know we have a shortage of nurses and we want the nurses that we have to work top a license. So getting really creative with the business strategy and the model to continue to deliver care is a national problem. And you'll see I put the note here that we do have some local pain. So here are our workforce barriers. And these are the things that we really need to combat. We need to get more people to come learn, grow, and stay in our state to be able to provide that quality care. You'll see that we have one of the lowest unemployment rates in the country, which we're really proud of. But at the same token, that means that the availability of workers that we need is shrinking. And so when you think about, your career, right now, if you look at some of the stats that are online, you'll see the numbers, thousands of positions that are open in healthcare, just ready for people to come in and take them. So you'll see some of the big positions like a registered nurse, where we know there's a national shortage. There's actually a shortage of faculty teaching nurses as well. So many organizations are focused on how do we get faculty to train nurses to be able to hire them. But then you'll see other types of roles here that are even outside of that position that we really need to look at and see how we can build the workforce of the future. So we are not unlike other organizations in that we've diversified our strategy to retain people and to recruit. But I would say that we are unlike many organizations in that we do have a very robust career development institute that produces and trains the workforce of the future. So surgical techs, pharmacy techs, licensed nursing assistants, medical assistants, fellowships for nurse practitioners and physician assistants. And you'll see that it takes a multitude of things, not only those training programs that you'll see at the top of that wheel, but other programs like partnerships with schools, partnerships with other employers, looking at how we can get people working top of license, hiring more business professionals to look at throughput, how inventory logistics, statisticians, technology and automation. Right now, we have in our system AI that's helping our physicians with their notes. That's going to become more and more prominent as AI grows. And how do we have a strategy that really gets after that, as well as addressing barriers to employment like childcare. There's availability of childcare, and it can be expensive too. In our region is one that we have 5 childcare centers now that we're continuously looking how do we grow and expand that, as well as housing. So housing can be expensive in our region. And so how do we create scenarios where we actually can subsidize housing so people can come and work in our organization and not feel like they can't afford to live in our communities? Because they certainly can, and we want to make that possible by removing those barriers. So I was asked to come and talk a little bit about our strategy, but I think the main thing that I want to get across to you is working in any organization, having a set mission, vision, what are the values for the organization, how are you going to drive the performance that you like to see among your employees, among your vendors, maybe you do have some automation and technology. Either way, you need to have a strategy year over year that gives you that North Star and actually helps you to understand, am I achieving the goals that I set out to do? So if one of our goals is to reduce barriers to housing, what are we doing instead of just talking about it, right? Are we actually putting pen to paper? Are we putting investment? A lot of times investment's needed to be able to execute on that. And so what you'll see here are some of those strategies that we've been working on year over year. And we're actually just getting ready to launch a new 5-year strategy or strategic plan for our health system that will help to further some of this. But also I'm really proud to say that we've actually checked the box on a lot of this as well. So when you think about some of the coursework that you've been taking or that you will take, things like managing performance, organizational behavior, inventory and logistics, I mentioned that one, business model, strategic planning, writing a request for proposal when you want a vendor to come in and actually making that, am I going to build this or am I going to outsource this type of decision? Those all play into not only the business, but are present in healthcare as well to continue to deliver the quality patient care that we all expect. So many of you here raised your hand, said you're from New Hampshire. That means I know you probably have heard of our organization, but also may probably had a loved one go there as well. So how do we keep that alive? How do we keep that growing? This is a slide that gives you a snapshot of our Workforce Institute and the varied programs that we offer and just the number of graduates that we've had. We've had over 500-600 graduates over the past handful of years, and we're growing those to be able to grow and develop our own workforce. So coming in, like you, coming in with a college degree, maybe not a lot of work experience, how might you gain that in the development programs that are offered by the employer? And that would be something that you would want to look at as you're looking to expand your career. So I'm going to take a breath. This is really the time for discussion and to open it up to all of you in terms of what your questions are. I'd like to hear a little bit about your goals and how either my organization, myself, or you're thinking about things, how you can help to advance some of your thinking so that when you walk out with your degree, which how many of you are right in the beginning of your education? None of you. Halfway. How many of you are at the end? Any of you at the end? A couple of you at the end. Okay. So give us time to have some discussion to give you an opportunity to answer or ask those questions to see how I can help you.